Good afternoon. I'm George Latimer, Westchester County Executive, and this is our Monday update on the coronavirus outbreak here in Westchester County. We're speaking on the 14th day of December, and the outbreak, which began in the first week of March, is now completing its 10th month by the end of the month of December. And we're going through the continuation of a variety of different rules that are set down of how we're going to function as a society in light of the coronavirus outbreak. Governor Cuomo is speaking in real time as we are talking now. We keep our 2 o'clock time frame. He's addressing the state right now for the second time today. We're monitoring his comments, and if anything happens in real time that changes any of the information we have, we'll be happy to try to report it to you while we're on Facebook at this time. The most accurate numbers we have on the coronavirus outbreak dates back to Saturday, the 12th of December. We're waiting to see updates for the results from Sunday and Monday, so we expect that there will be some additional movement. We've watched about 8 weeks of continual rise in coronavirus outbreak and infections, in the number of people who are hospitalized, and unfortunately the number of fatalities. Our Saturday total during the totality of the infection year to date, so to speak, since March 1st, 58,244 people have been infected by the coronavirus here in Westchester County. 49,646 of them cleared protocol 2 weeks ago. So that gives us a total number of 8,598 active cases as of Saturday. Now, that number has been steadily increasing with one or two glitches where it goes backwards just a little bit, but it's been increasing steadily over the last 8 weeks. And what it means is we're certainly testing more individuals, but we're also finding more people who test positive for coronavirus. The infection rate has been in the 5 to 6% range, which is much higher than it was during the summertime when we clearly had a lull. The basic slope of this is pretty obvious. We started in March. We ascended rapidly in the number of cases through late March into early April. We started to flatten off in April, start our process down in April. Took a while. It came down slower than it accelerated through April and May, and then into June. We had July, August, and even September were fairly flat. We still had a number of active cases in the range of 450 or so active cases. At one point, we had 12,000 active cases at our peak in the spring. And now we've seen in the last 8 weeks, 9 weeks now, a steady increase in the number of active cases. And again, as of Saturday, 8,598 active cases. If there is any good news in all of this, is that the number of active cases, when we last had this many, we were on the way down in the month of April, we had about 8,600 cases. At that point in time, we had 953 people hospitalized. So 900 some odd out of 8,600 cases, over 10% hospitalization of all the people that had the virus in an active way. At this point in time, our number of active hospitalizations range in the 360 range, 360 people hospitalized. That's significantly lower than it was in the spring for the same number of active cases, and that puts our hospitalization rate somewhere in the vicinity of 4.5% or so forth, which is, as a percentage, much better than it was in the spring. So we hope that means this strain of the virus that we're experiencing may be a little less intense. Perhaps it means that our medical professionals have a way of handling the treatment for this. Once a person contracts COVID, we do not have a cure for COVID. All of the discussion of a vaccine is not the same as having an antiviral treatment, which is what you treat somebody when they have the disease. You saw that when President Trump contracted the disease, they gave him a cocktail that involved some products from Regeneron here, based here in Westchester County, and that helped. There's also a drug, I can't pronounce it properly. I think it's Remdesivir or something like that. I apologize for not being able to get it right. That is used in some cases for people who have the disease, but we do not yet have an antiviral treatment. So it is encouraging that there are less people sick enough to be hospitalized based on the same amount of infection. However, the spread of the infection is concerning because we have basically shut down all of our community and public activities, all of the festivals, the civic clubs, the celebration of holidays, religious holidays, secular holidays, they've all gone by the wayside. We haven't had block parties and group gatherings. Most houses of worship, if they're not virtual in their ceremonies and their services, are reduced in how many people come inside the sanctuary or inside the synagogue, temple, the mosque. and we're dealing with a still high increase of infection. So it does mean, and I think this is the principle the governor's talked about, is that the disease is spreading more because of our interpersonal contacts outside of the public domain and in our private dealings, in our private situations, in our private homes, when we visit other people at their homes, however we cluster with smaller groups of people. And it probably means that infections are being family-wide once they're felt, that a person who gets it is now infecting the other people of their immediate family, which is raising in the multiple number of cases. Whatever it is, 8,600 people, active cases as of Saturday, approximately 360 hospitalized individuals. Now, if you go on to the New York State Department of Health tracker, the numbers will be increased over that. They've just updated the tracker within the context of our being on the air. We'll see if that's a 1 or a 2-day update. I want to make sure we're tracking the correct numbers against the proper 2-week-ago number and a year-ago number so that when we make assumptions off of numbers, they're accurate assumptions. They're not just fly-by-night guesses. So we'll double-check that. What we know is what we have on Saturday, and that is reliable. We have lost, as of Saturday, 1,558 people throughout the course of the year. 10 days ago, we had a ceremony down in Yonkers at Lenoir Preserve through our Ribbons of Remembrance program to remember those individuals. Now that remembrance is inside of our county office building through the winter months, and then we'll structure it so that it goes back outside when the weather is appropriate. But we are starting to see a higher number of fatalities. Again, not the same that we had in the spring, but if we track from Saturday the 12th, in 1 week, we lost 31 individuals. That's a significant number. We went the whole summer and lost 11 in the 2 months of the summer, and just in the last week, we've lost 31 individuals. If you go back 2 weeks ago, that number is 45 individuals that have been lost just in 2 weeks, fatalities. And if you go back slightly before that, the number is 59 individuals. So 3 weeks ago, which would be the Saturday before Thanksgiving, to date, we've lost almost 60 individuals, fatalities in that period of time. Those numbers are concerning, and they bespeak of some issues. Now, the governor has laid out a review all across the state, not just in Westchester County, of the level of infection, the percentage of infection, and has created 3 zones, yellow, orange, and red zones. We've talked about this before, which represents degree of shutdown of the society. It affects schools, it affects dining, it affects businesses and houses of worship, and there's different things in each of those grids. We are awaiting an update from the governor that may modify that plan to some degree. 2 weeks ago, when we had a conversation along these lines, he made some changes to what the programs were in the orange and red zones for schools. So they didn't have to automatically close. They could stay open, but there was a testing component that was added to it. And so we're hopeful to hear what the governor lays out. The governor has executive authority to do these things within the context of the state. In a second, we're going to have the mayor of the city of Mount Vernon joining us here to give an update on that city. We've had the mayor of New Rochelle and the mayor of White Plains with us last week. We'll have the mayor of Yonkers coming up. Mayors have executive authority. County executives have executive authority, but the governor's executive authority supersedes that. So as he sets down the rules, and it falls to the mayors and the county executives across the state to figure out how do we help the people that we represent, how do we help the businesses we represent survive, how do we help the people survive, and how do we implement those decisions that are being made at the state level. And I caution it by saying that the governor consults with the people around him in public health and so forth, state legislators, county legislators, city council members, mayors, county executives. We are all individuals in a sphere that try to shape to some degree how these things are implemented. But it is the governor of each of the states, governor of Connecticut, governor of New Jersey, governor of Pennsylvania, governor of California, that sets out these rules using executive authority. In Westchester County, we're still operating in the last 3 weeks under a set of 6 zones that were created by the governor, 1 in the intermediate level, orange, in the village of Portchester, and then 5 yellow zones, which are the precautionary zone, the least restrictive of the 5 zones, and those are part of the city of New Rochelle, part of the city of Yonkers, the larger portion of the villages of Tarrytown and Sleepy Hollow, a large portion of Ossining Village, and then a significant portion of the city of Peekskill. And there is some yellow zone designation that surrounds the orange zone of Portchester that affects portions of the village of Rybrook and a little portion of the city of Rye. Those zones restrict action in those areas, but the rest of the county now still operate under the general restrictions that we have. The general restrictions include all restaurants must be closed by a certain time of the night. There can only be a capacity of such and such a percent inside different entities, and they've been established for houses of worship and gatherings, public or private gatherings, and a host of other different parameters. The city of Mount Vernon, and I always am proud to claim that as the city that I was born in and grew up, spent the first 25 years of my life in Mount Vernon. The city of Mount Vernon is the densest populated municipality in Westchester County. It has managed through its work to avoid reaching the point at which a zone needed to be named. And I credit the hard work of the professionals of the city government. And we want the mayor of that city, Shawyn Patterson-Howard, to join us here to talk a little bit about what's happening in Mount Vernon. Mount Vernon is a city that's impacted by poverty. And there are a lot of good people that work with a reduction in the access to health care in that community. And so the mayor and the people in the administration, the members of the Common Council there in Mount Vernon, are working to try to help deal with those issues, and those of us in county government are trying to be a good partner to all of our cities, all of our villages and towns as we go forward. So with no further ado, the mayor of the city of Mount Vernon, the Honorable Shawyn Patterson-Howard. Madam Mayor, thank you for coming.
Thank you.
I'll extend a warm elbow.
Yes.
Thank you.
Thank you so much. I always want to say thank you so much to our county executive, Latimer, who has been an incredible partner, and now this becomes part of my wrist jewelry. In working with the city of Mount Vernon to address COVID and so many other issues in our community. And as you said, County Executive Latimer, Mount Vernon, as the densest community in Westchester, has been able up until this point to avoid being listed in any of the designations. From March of this year, currently to this date, we've had 3,828 cases of COVID. We currently have 294 active cases. We are waiting to get our update from the county. As the county gets theirs from the state, we'll get ours from the county. And we had, the last number, we had 26 new cases. As of Friday, we were up to 79 deaths in the city of Mount Vernon since March. And within the past 10 days, we experienced our first death since June. And that was very hard for us to deal with. But as we've already stated, there's been an uptick throughout the county. It's really interesting, as our governor has said and as our county executive have continued to say, that the spread of COVID right now is familial. It's household based. It's people who know one another. It's family, friends who are coming to gather in each other's homes, whether it's for family events or social events. And so that is where the spread is taking place, and that is where we're trying to focus so much of our attention. As everyone gets really excited about the possibility of a vaccine, we still have to be very diligent and very vigilant in making sure that we do not put our guard down. We have been in a COVID environment, and that's what I call it, a COVID environment. It's not a post-COVID because we're still dealing with it, and we have to continue to wear our masks. We have to continue to social distance, and we have to continue to sanitize our hands and our working as well as our home areas. In Mount Vernon, people have asked constantly, well, where do you see clusters? Where are you seeing the highest rates? We have 3 zip codes primarily, 10550, 10552, 10553. It's really interesting as we've dig down and drilled into our numbers, the percentage of people in each of those zip codes is exactly the same percentage and rate of infection in each of those zip codes. So 10550 has 55% of our population. That is our largest and most densely populated portion of our city, and we have 55% of the cases. 10552 has 29% of our residents, and we have 29% of our cases. And 10553 has about 15.4 to 16% of our residents and 16% of the cases. So the cases are widespread. It is not discriminating, and that's why we continue to do education throughout the entire community. So one section of the community is not impacted more than the other. Expanded free testing is available at Mount Vernon Neighborhood Health Center. We're grateful to the state. They gave us a testing site back in the end of May, and we were able to stand that up. I went on Friday, just this Friday, to get a updated COVID test, and I got my results at about 12 o'clock today, and I'm negative. And this is something that I do on occasion. I don't go constantly to get tested, but as we encourage our residents to be tested, because it is the asymptomatic spread of COVID that is the biggest spreader of this infection. People who are asymptomatic and don't know their status are the ones who are spreading it, and it impacts their friends and family sometimes in a very different way. And so as a resident, as someone who's worked in public health, I want to make sure that I'm aware of my status. But even when you're not aware of your status, if you use the universal health precautions and the protocols that have already been put in place insofar as wearing a mask, social distancing, and not having large gatherings and gathering outside to an extent, then we can continue to keep the infection rates down. We also have rapid testing available at Montefiore Hospital and Medical Center, right on North 7th Avenue. So they've just reopened their rapid testing site there. We encourage you to go there. Other people are going to their doctors and some of the urgent care centers in the region. But please make sure, if you're concerned about your status or if you just need an update, to get tested. One of the things that have really helped us to be successful here in Mount Vernon, COVID came out of nowhere, and none of us has ever dealt with anything like this before. But back in March, when we saw the numbers start to rise in our region, we put together our COVID-19 task force, and it was broken into two. One was called the Essential Business Task Force, and the other the Social Distancing Task Force. And we put together an incident command system structure that was led by our Chief Robert K. Odendo of our fire department. And we have our police department, our fire department, our DPW. They're in the operations area. We took our front-facing departments like Youth Bureau, Veterans, Recreation, and Seniors, and they became our Human Services Division. And then we had our logistics as well as our finance team combined of different departments. And so we've gone out into the community, and with the essential businesses, we wanted to make sure that they were following COVID regulations. With social distancing, we wanted to make sure we did lots of education in the community instead of just focusing on enforcement. And as the communities began to reopen, and we looked at the end of May before we went into the phase 4 reopenings, we took our essential business team and turned them into our reopening team. And they went out and did lots of education in all different sectors of businesses based on the phase in which people were to reopen. And we created a campaign called Mount Vernon Resilient. And so just like you have Better Business Bureau's symbols in people's windows, we have Mount Vernon Resilient. We did workshops for the personal care industry, for the restaurant and entertainment and bar industry, hospitality industries, construction industries. We've worked with people based on industry to ensure that they understood their New York Forward protocols. They understood what we were requiring with them as a city of Mount Vernon. And then we continue to go out and enforce those regulations. We help them open up and be compliant, and also to develop the best practices. We continue to do that work around compliance and business development, and we've reached out to the New York State Liquor, at the SLA, the New York State Liquor Authority, as well as the Department of Environmental Conservation and the County Department of Health, as we continue to go to businesses, ensure that they're COVID compliant and city ordinance compliant. We have to understand that the health of our economy is going to be directly impacted by the health of our residents. And so that is why we are so serious about ensuring that our business community works with us as partners, because if the numbers continue to rise, then we will move into yellow and orange and red designation, and we're at risk of close down. So us making businesses comply is never personal. It's strictly about the public health of the community and the economic health of the community. So we will continue to do that work and work with them. We have shut down businesses that have not been in compliance, and we will be finding businesses that are not in compliance, but we're also there to help them reopen. We continue to do a lot of work around food insecurity, mental health, substance abuse, and helping people get through this COVID fatigue that many of them are experiencing. The city itself has led the efforts to give out over $1.2 million of food to our residents. And then we have given out probably another 1,000,000 pounds of food through 14 different community-based agencies and faith-based agencies that we partner with. We are doing mental health counseling. We're doing phone check-ins. We're doing lots of exercise, arts and craft, and after-school programs on Zoom just to help out the community. When we've distributed over 75,000 home-delivered meals and doing a lot of expanded senior services with the support and help of our county government. We have launched Kristen's Closet in the Department of Veterans Affairs, and so we're doing a lot of targeted outreach to our veterans to help them through this time. And through our IDA, we have hired Robin Mack, who works as our small business development individual, who is also over COVID compliance of our businesses. So we will continue to do this work. We're really proud of the work that we're doing. And while people are getting excited about a vaccine potentially coming out, or the vaccine is coming out, the rollout of it is going to take a while. And so we have to continue to focus on the health of our community and continue to do the things that have helped us survive as communities around Westchester, around New York, and around the country for the past 9 months now. So everyone continue to stay safe, continue to be responsible, wear a mask, social distance, wash your hands, and thank you so much, County Executive Latimer, for giving me this space, and thank you to the residents of Mount Vernon for being partners, as well as my team for being incredible and doing all of the extra work that you continue to do. Blessings.
Thank you very much. Again, I want to thank Mayor Shawyn Patterson-Howard from the city of Mount Vernon for being with us here to provide an update. Those of you who are watching across the county know that we did this in the spring, and we're doing this again now as we reach the wintertime this year, having mayors and supervisors join us here to talk about what's happening in their specific municipalities. There are 45 different communities of various sizes in Westchester County. Some are very small, some are much larger. The urban environments of Mount Vernon, New Rochelle, White Plains, Yonkers have very unique problems, and the effort by the city government to try to address them is essential, but they also need partnership, and the state and the county and the federal government need to be partners with the municipal governments to help these things happen. And in weeks to come, we'll have other mayors and town supervisors join us again to give an update so that you can see the size and the scope of what we're trying to do. This is, for people who don't follow all the details of government, it can be a confusing system. They know the city you live in or the community you live in, and there's a federal government because it's on TV every night. But what the role of a state and what the role of a county government is can be a little bit more amorphous. And very simply, the county government is a regional local government. Mount Vernon and the other cities and the towns and villages are local governments that provide services for a specific jurisdiction. We, the county, provide services for all of those jurisdictions where they overlap, public health being one of them, and that's why it's such an important emphasis here for the county to work with the cities as partners and the villages and the towns as well. So again, to Mayor Patterson-Howard, we thank her for being with us here. She's got to get back to work down in Mount Vernon, so we appreciate having some of her time with us. We want to talk about a couple of the other major issues that are on the table. First of all, with the announcement that vaccines have been approved by the federal government. The Pfizer and vaccine has been approved. I believe the Moderna vaccine is on the verge of approval, and there are other vaccines coming from other pharmaceutical companies. There now has been the beginning of a distribution network, and I'm following this as you are in the national news, X million number of doses that are going to be given out across the United States of America. We are a nation of 320 million people, and if every man, woman, and child got one of these doses, that's a significant number, and we are just a fraction of the world's population, and this is a pandemic. This is in the most rural parts of some of the most remote areas on Earth that also suffer from this situation. So how the federal government makes the decision to allocate those resources and working through the states of the United States is really the first round of activity. New York State then being the government that will lay out a game plan that we in the county and other levels of government will work on. We know that the primary recipient of vaccines as they're made available, and that's happening in parts of the United States as we speak, are the high-risk healthcare workers. That's the hospital and emergency room workers, the nurses and the doctors and pulmonary staff, ICU staff, the people that are up close and personal with those who may have this disease or are subject and prone to this disease. Those workers have had disproportionate fatalities because of their working with the disease, even using PPE, masks and gloves and shields and so forth. The disease is an airborne disease. It's easily conveyed from one person to another. And in a medical setting where you're seeing patient after patient after patient, every one of them has COVID, the chances of you being exposed as a doctor, a nurse, a respiratory therapist is very high. So getting the vaccine to those individuals right off the bat is essential. And then the second group that's right behind that are nursing home staff and residents. We know that people are in nursing homes because they have some severe health issues that are extended over a period of time. Many times these are folks in advanced years of life or who have gone through some very serious illnesses and are residing in a nursing home because they need round-the-clock attention and care more than they could get even if they have an in-home person working with them. So nursing homes follow in the second rung of recipients. Then in the phase 2 of vaccine distribution, we're looking at very generically first responders. That would be EMS individuals, police, fire. As you can imagine, when you're responding as an EMS worker to a person who's in cardiac arrest at a home, you don't have time to find out are they COVID positive or not. You don't know. You need to put them inside the vehicle and bring them to the hospital, and therefore you may be exposed as an EMS worker to COVID. And the people in the hospital who do the transporting of the individuals long before we get to the medical professionals are all potentially exposed. They need to have access to the vaccines. Then we look at public health workers, people who work in our county Department of Health, teachers and school staffs who deal with a broad spectrum of children. There's essential frontline workers that regularly interact with the public, particularly in moments where their services are considered essential. So if you are in a pharmacy, if you are in a grocery store, if you're a transit employee, all of those positions deal with the public on an everyday basis, and you could very easily be exposed to the disease. So they would then be in that sequence of events to be able to get this. There are other long-term care facility patients, those who are in congregate settings, those who may not be in nursing homes, but they're in assisted living or in senior housing, subsidized housing. They're not uniquely ill, but they are more vulnerable because of their age and their general health. And then we leave it up to those in the general population to be prioritized on the basis of the need there. The phase 3 vaccine recipients, as we continue down the level of priority, still important as part of the general population of people who are over the age of 65 years of age, and then individuals who are under the age of 65 but have high-risk comorbidities and health conditions. And those individuals are more subject to the fatal impacts of COVID and therefore more in need of the vaccine to protect them for that. All essential workers in phase 4, and then phase 5 vaccine, which is the majority of folks, healthy adults and healthy children, and obviously adults below the age of 65. Now, here in Westchester County, the way those priorities lay out, and those are very logical priorities as we see them come out of the general dialogue of the federal government, the CDC, and now the state government, those make sense to us, that we're getting the vaccine first and foremost to the people who are in the most potential exposure because of the healthcare industry and then all the related things I've talked about. There are shipments that are going to go to pharmacies in Westchester County, but they are specifically for the use of nursing homes, staff, and residents. That is the target goal as they are going to hospitals to treat or to be provided to hospital workers. They go to those pharmacies specifically to be helpful to the nursing homes. You cannot go at this stage of the game into a pharmacy or into a hospital and say, I want the shot. You need to talk to your doctor and then determine what your circumstances are that will allow for you to have that vaccine. And because right now we begin on the front end of this with a limited amount of supply, we don't have the full amount of supply available to us yet, we intend for that to go in that priority order. Those high-risk individuals need to be serviced first. Let me also point out, which as a layman I understand, and I trust you understand too, a vaccine is not a cure for a disease. A vaccine is a preventive treatment that would help reduce the likelihood that you would get the disease. We've heard that these vaccines are 95% effective which is a pretty high percentage. There is a portion of which, I guess, individuals based on any number of different reasons where the vaccine might not be effective. I took a flu shot rather publicly each year now that I've been county executive, and they tell you that the efficacy of the flu shot might be 60, 65%, meaning that you could still get the flu even though you've had the flu shot. Now, the flu shot doesn't require deep refrigeration or things that the COVID vaccine requires, so it's more easily given out. You're more easily able to access a flu shot. We just had a period a week ago where we provided free flu shots, and we have that capacity going forward. But the nature of the issues here is that since the vaccine is not a cure for having the disease, we still have to show the same diligence in doing those things that we've been told now for 10 months are necessary: mask wearing, the sanitizing or washing of your hands, social distancing, and the contact tracing function, in which, if you are exposed, you need to identify those individuals who you've had contact with to try to isolate it from expanding across the board. We saw what happened in the very beginning of this. We had one case, and then we had 100 cases, and then we had 1,000 cases, and then we had 10,000 cases in less than a month. That's the communicable nature of this disease. Now, when we wear masks, we reduce it. We don't eliminate it, but we reduce the potential of the spread. When we sanitize our hands and we don't pick it up from a surface, that reduces the amount of spread. When we have social distancing, even if I cough, you're not close enough to me to pick up the virus from me in that fashion, and the mask protects you. It limits what I might expel. All of those issues are there. So it's important for us to realize we're looking at a light at the end of the tunnel. But there is a tunnel, and we're still in that tunnel, and we're going to be in that tunnel for a while longer. And it's going to be particularly difficult because we're going indoors, cold weather season. It's Christmas time and other major holidays, and those are times we want to get together. The Feast of Kwanzaa, which follows the Christmas Day feast, is very important in our African-American community. That's a time of gathering together. We're on the 5th night of Hanukkah tonight as we speak. That's a point of gathering together for our friends in the Jewish community. And then once we get into New Year's Eve is perhaps one of the biggest secular parties that we have, a festivity of seeing a new year come in. And if anybody wants to have one more day of 2020, I don't know who they are. We all wish that this year didn't happen quite the way that it did. But the bottom line is that we have to continue to show the diligence of these things, and we will try to continue as a local government to try to enforce those rules. We try to enforce it based on common sense and based on gaining compliance of individuals. We are not looking for confrontation. We understand that some people out there hold certain philosophical views. We cannot let those philosophical views involve infecting other people, but we also, by the same token, do not want to create unnecessary conflict. So I repeat what everybody repeats to you: use common sense. This is not a political statement. I am more than happy to take this mask off and put it in a drawer and never put it on again if I don't need to. I have no desire for you to put the mask on for any reason other than to protect public health, to protect your health and the health of the people around you. And I think it's important to say. Now, human nature being what it is, the minute something arises like this, there are always those people who will try to take some financial advantage of it. And now we're hearing about, just as we hear all the time, there are vaccine scams that are out there. People will solicit you. They might sound very professional. They will look to get information from you or money from you in order for you to get a vaccine, perhaps outside of that priority order that I just referenced. You cannot pay to put your name on a list to get a vaccine. That is not how it is structured. As Westchester County Executive, along that list of priorities, I'm reasonably healthy as far as I know. I am over the age of 65. But my priority list is further down the line than many other people. I will wait my turn. There is no way to jump that and to do that appropriately. And more likely than not, it is a scam where someone is trying to get you to give them money. If you get solicited with a call, with a text, with an email, somebody knocking on your door, and I can get you early access to a vaccine, that is almost completely likely to be a scam. Don't fall for it. Don't pay attention to it. Speak to your doctor. Talk to your doctor about the need and the urgency you have to get the vaccine, access to the vaccine, and based on your priority, that is the path that will get you to the vaccine not any of these individuals who are really trying to part you from your money and will deliver nothing to you. We have scams of all sorts. We have a Department of Consumer Protection. We bring Jim Mazzano up on camera every so often. People who come to your front door, they'll pave your driveway, but you got to pay all up front. You never see the money, and you never see the paving of your driveway. The same is going to happen now with vaccine scams. Be wary and be alerted to that. We continue to work with our municipal governments and our local school districts in terms of implementing all of this. I mentioned before the governor, we look to him as he lays out certain game plans. Every Monday when I report to you at 2 o'clock until 3 o'clock or whenever we break this off, we have at 3:30 a municipal call with the various local elected officials, Mayor Patterson-Howard and her colleagues around the county. We get on a call, we exchange whatever information we have. That call also includes state legislators, state senators, state assembly members, county legislators, chair of the board of legislators, and the members of the board, as well as local officials. And then every Monday morning, first thing on Monday morning, we have a conversation with the various school superintendents to share with them as well the information we have and to try to deal with the way they have to manage the issues in a school setting and in a general public setting. And we're trying our best every day to make some decisions that we think are practical. We'll talk about a few of those in a second in terms of how we're dealing with the business community. We know that we're seeing a rise in cases, a rise in hospitalizations, and a rise in fatalities. The degree is not yet as serious as it was in the spring, but we saw what happened in the spring, and we have to project and plan for the worst-case scenario. And one of those things is to deal with a significant increase in the amount of fatalities in a short period of time. No area is really prepared for the loss of civilian death at some level of capacity. We have a certain number of funeral homes in the county. We have a certain capacity in Westchester County to conduct autopsies on those who have expired. There's a certain amount of capacity at our various cemeteries to bury people within a certain time frame, and in those facilities that cremate bodies, as that has become more common, to cremate. All of those things have limits to time, space, and manpower. And when the civilian deaths, and I say civilian because if we were in wartime, we would structure this completely differently. But since we're at a civilian setting and we don't know just how much our system is going to be taxed, we have to take steps in advance. One of those things that we have done is to store 2 refrigerator trailers on a long-term basis that could serve to house those that have expired because we don't have the capacity when we reach a certain number to be able to deal with the final resolution of those individuals for a proper burial or proper cremation as their wishes are. We have land on our county campus in Valhalla. It's tied into the headquarters for our Labs and Research Office, which is where we have our morgue and our coroner function, autopsy function, and those trailers now have become an unfortunately permanent part of our life to be prepared to use if necessary. You may have read something in the newspaper about them. It is ghoulish, but it is necessary. And when I ran for county executive 3 years ago, the topic never came up, not in any conversation I ever had, not in any debate that I ever had. But the issue is before us, and we have to be prudent. And just as we have a backup field hospital awaiting use if we need it at the county center, 110 beds, so now we have available capacity to retain those who have expired so that they can have a proper burial and a proper cremation. We know that we have lost the ability to say goodbye the way we want to. It's why we have ribbons of remembrance. I did go to a wake this weekend, probably for the first time in a long time. And, you know, we have certain ceremonies. We have ceremonies when people get married, ceremonies when babies are born. We had a ceremony today with the promotion of people in our Department of Public Service. Those human ceremonies mean a lot to us as people. They're connective things that make us feel not just like automatons that are surviving, but as people who are actually living. And the point of death, which of course none of us experience until we reach that point and we don't come back to talk about it, but when we lose people we love, parents, spouses, children, neighbors, friends, there needs to be a human grieving of those things. We're not possible as human beings to ignore that structure, that process. And hopefully we'll have the proper way to respect all of those that we've lost in a variety of memorial services that will follow the end of this pandemic. But for now, we're doing what we have to do that is practical and reasonable. Also practical and reasonable is to deal with the economic problems that are faced by our business community. Now, I've had people tell me, whenever there's a restriction and the restriction tightens up, where you can dine and where you can do business. And someone says, "Don't you understand? Don't you understand? I'm going to go under financially." No, we understand. I come out of a corporate background. I'm involved in a business. In fact, I was involved in an industry that now is one of the most impacted industries by this pandemic. And people that I worked with now who have lost their jobs, having had a whole lifelong career in a particular industry, and now they've seen layoffs across the board, senior management right down to hourly employees, that we do understand that this is a terrible burden. What we try to balance, and we've tried as a county government to balance this every day, is to what degree do we have to restrict activities in the society to restrict the spread of the disease? And to what extent can we open elements of the society that we have control over? Governor has the overarching control in order to allow people to live their lives. And we've talked about that. We'll talk about it again in a few seconds, about the recreational facilities that we have and how we've kept our golf courses open and how we kept our bicycle Sundays going throughout the bulk of the spring, summer, and fall in order to provide a recreation. We'll talk about a few more things. But we're mindful of these things. And for those who want us to, at either extreme, shut everything down or open everything back up, they're not understanding that that balance is essential in the society. If you just open everything up, a person might say, well, my business has a chance to thrive. If that pandemic starts to spread at multiples of what it already is, 3, 5 times as much, and death follows that, as I said more than once before, death is bad for business. And there are many people who will not interact in the society economically if they do not feel safe. It might be that you feel safe and you say, I'm going out there, but the business can't function until they achieve X amount of people buying their service or their product. And it might be that a third of X is ready to go out tomorrow, but a significant portion isn't. And I judge that even when I go to church on Sunday. And I see that the church has a certain reduced capacity, but it is not filled to the reduced capacity. Why is that? There are people who are making the decision that they're going to watch the service at home. They don't feel comfortable going into the sanctuary of the church. That is their decision that they're making. So the open it up philosophy, which appeals to some people, I saw the big crowd a couple of weeks ago in front of a bar in Staten Island demanding the right to drink. The right to drink. I think I missed that being in the Declaration of Independence or in the Constitution, that you have a right to drink publicly. But be that as it may, that is a portion of the population. That's not the whole of the population. On the other side of the coin, the desire to shut everything down over an extended period of time does not truly take into account the complicated element of this society's economy. And if the society's economy completely collapsed from an extensive a shutdown, we have a completely different America to deal with. When the totalitarian countries shut down completely, they are structured around the government deciding everything. That is not who Americans are. That is not who I am, regardless of my political affiliation. So we're trying to strike a balance. Part of that balance is to take public resources and to help people who are suffering. If they have food insecurity, if they're afraid of being evicted, we take federal money and county money, and we try to address that need. So have we done with small businesses through our Business First program. In our Business First program, we have taken an allocation of money that we received through COVID CARE Act funds, and we've made grants available, not loans, grants, to small businesses, 99 employees are under, to try to help them weather through this storm. And the person who's been responsible for that job is Bridget Gibbons. She is our Director of Economic Development. When we talked in the beginning of the year of our plans for this year, we were in a new cohort for Element 46, the incubator project, which was her brilliant innovation idea. We were just beginning the process of doing an economic development plan, long overdue. We haven't had one of those in 20 years, and the world of business has changed dramatically. We're on the cusp of doing that. We had plans to bring in some outside consultant assistance on opportunity zones, which is a way to target some real estate benefits for those who invest in certain targeted areas designated by the federal and the state government. And now we find that previously viable businesses are on the verge of going under or have gone under. The county government is not the federal government. It is the federal government that has the resources to really address these problems. And the arguments of Washington, D.C. are Washington, D.C.'s arguments. I am not in that arena. I am in this arena. But in this arena, we've been able to target some money and target a plan. And I'd like Bridget Gibbons, our Director of Economic Development, to share some of the actions we've taken. Bridget was with us on the very first briefing that we had, which is right here when we were configured this way in early March. And so now, 9 months later, Bridget, what we never envisioned, here we are trying to help businesses from going under. Please tell us where we are.
Great. Thank you, County Executive. I want to echo what the county executive said in that we understand. Before I took this position, I had my own business, and I know how devastating the pandemic would have been to me, to my business, to my employees, to my family. So that really, urges me to, work as hard as I can to help our businesses that are suffering so much. Today, I'm pleased to announce that our second round of Business First grants have been awarded for a total of $4 million to an additional 200 county-based small businesses, nonprofits, and our chambers of commerce who are facing tremendous challenges as a result of COVID-19. The funds, as the county executive said, come through the CARES Act, through our Westchester County Business First program. So FIRST stands for Financial Investments for Recovery and a Sustainable Tomorrow. A few facts about our awardees. They range from solopreneurs up to larger organizations, up to 99 employees. 50% of our recipients had 5 or fewer employees. 25% of the awardees are our very smallest businesses. Awardees represented a wide range of industries, everything from transportation, childhood education, coffee shop, bakery, restaurants, a florist, yoga studio, and more. Nearly 40% of the recipients are women-owned, minority-owned, or service-disabled veteran-owned businesses, and 20 chambers of commerce applied for and received funding in this round. These organizations have played a critical role in our communication to the business community, and also they've provided support for their members throughout this crisis. A full list of awardees will be made available once they've all signed their grant agreements. To those businesses who did not receive a grant in the second round, we're working to secure funds for additional rounds of funding from the federal government. You don't need to resubmit your application. We will authorize additional grant money if and when those funds become available. Just a reminder that we also launched, as part of the Business First program, 2 entrepreneur-facing focused programs. Launch 1000 is our program to launch 1,000 startups in Westchester County, and Westchester Rises, which is a program for more mature startups and businesses who need help to redo their business plan and need help pivoting and rebuilding their business. To learn more about those programs, go to westchestercatalyst.com and click on Business First Programs. I want to thank the county executive for his leadership and support as we do everything we possibly can to help our businesses get through this really, really difficult time. Turn it back to you.
I want to compliment Bridget and her team, Deb Novick, who serves with her, Sherry Asher, who works in cooperation, and Corazon Pineda and Chloe Zung, and a host of other individuals who are part of the economic development team. There are many things that we can do, that we need to do here in Westchester County to develop our economy. The impact of COVID staring us in the face has become now the single most important thing that was done. We had an announcement a couple of weeks ago that the Morgan organization is expanding their personnel based here in Westchester County, significant expansion in Westchester. We don't take credit for that, but it is a climate that is important to us, that's pro-business in a productive and intelligent way that grows jobs. The IDA funds that we have, we try to use to help incentivize projects that will contribute to the employment base or affordable housing, depending on the nature of the project. Bridget's involved in all of those things. We always can do better. We always can do more, but I think this is an example of how this government structured resources that it had access to. $10 million in the first round, $4 million in the second round of funding. And that second round of funding we authorized because we saw the demand for the 262 organizations benefited. 1,000 plus applications came in. And that's how across the board the need is. I know in the village of Portchester, as one example, because they're at orange zone status, businesses are in dire straits there. And I know Portchester very well. I've represented the community for over 15 years. And the need is tremendous. The county government cannot do everything to change those things, but we're trying to do what we can do. And when you see the debate in Washington, D.C. going on about, do we need another stimulus? And we argue, no, we don't, yes, we do. Think of the local businesses that are going to go under through no fault of their own. They have a service or a product that is worthwhile in consuming, but people can't come out to shop in their facility, or the individuals don't have the resources they did because they themselves are impacted financially, they're laid off or whatever. And those businesses can't survive without a steady flow of revenue at the top of the pyramid. What we're doing doesn't replace the revenue, but it gives them an opportunity with a grant to do something that then might help them capture revenue. In the initial round of grants, which came earlier in the fall, we saw restaurants getting outdoor heater components so they could have outdoor service and they could maintain through at least September, October, and part of November a revenue base for them that they hope will help them survive a little bit longer into the winter when no matter what you have, you're not going to really be comfortable outdoors. There are people that use that allocation of money to put plexiglass shields up to protect people so you could reduce the amount of infection in a retail setting when somebody comes in a retail facility. They've used it as part of an investment to improve the HVAC system so that it would circulate the air better in a confined area and people would feel more comfortable walking into a smaller store. So whatever the local business thought the money could help them to use that to help them, that is what the purpose of this isn't just, hey, you're losing money hand over fist, here's $20,000, here's $40,000, and I hope you feel a little bit better, like putting a Band-Aid on a broken arm. But I think it's important to understand that's why the role of the federal government is so important. It's not just like the scene from the Broadway play of the movie Oliver, where an urchin comes with a dish, more please. It is money invested to make the business survive. If the business survives through this pandemic, it hires people to work. It provides a service or a product profitably, and then it contributes taxes to the society, and then the successful business people generously donate to the not-for-profits in their community, and the individuals grow. The rising tide lifts all boats. That's what the stimulus is for. It's to help us get through a very specific set of circumstances. No one expects this society to survive over multiple years with this kind of money being spent from a government source. But if it gets us through the pandemic, and we have a better chance to see the other end of the pandemic when we see the vaccines come on the scene. Now we know there's some proximate time frame that we're in this tunnel. It's not an open-ended tunnel that's just dark all the way down the line and throw more money at the problem and nothing's going to happen. We see the potential for that to happen. For those businesses to go under now would be a crying shame. So close to the potential of seeing this whole thing turn around in the society. So the efforts that we've made, I think, are a step in that direction. We've tried, I think, very hard. I want to compliment Bridget and her team. And I'm a person that's very clear-eyed about how many other people have contributed to a successful result. Joan McDonald, our Director of Operations, Emily Saltzman, our Deputy Director of Operations, have done yeoman's work in this area. Bridget has had partners out in the community at large. We always compliment the work of the two major business organizations in the community, Business Council of Westchester and Dr. Marsha Gordon and John Ravitz, and then also the Westchester County Association, Mr. Michael Romita, and Amy Allen, who are principals of that organization, the work they do, and every one of the local chambers of commerce. This is what Sherry Asher works with. I attend a lot of their meetings on Zoom. Those local chambers of commerce are trying very hard to hold it together under the worst set of circumstances. We're happy that we can provide some support for them in their efforts. Now, someone, will use the political, correlation, and they'll say, well, you're of this particular political party, George. Your party doesn't think in terms of business. Well, this disproves it. This shows that we understand that there is a need for people who don't have access to food, and we put money into food insecurity. But we also put money into small businesses because we believe that's an essential part of what will make this economy grow. And we also know, I've said this many times before, the perception of Westchester County is the corporate headquarters that we have based here, the IBMs, the MasterCards, Regeneron, PepsiCo, all magnificent companies. We've had others in the past that were here and are gone, and those have stayed, and others are attracted in. But the small business entity of Westchester County actually employs more people than the large business corporate headquarters do. And so we're very grateful for those businesses. We are trying to do what we can with the resources available. And again, Bridget, thank you and your team for the leadership that helps that to happen. Now, we are shutting down, I guess, at the direction of the governor, certain things in the society. We haven't been in a movie theater in a while, and we haven't, many of us, enjoyed any kind of an outdoor sporting event in the stands to watch, any of the sporting teams. I'm a hockey fan. The hockey season is coming back in at some point. I'm a basketball fan, although I hold very little hope for the Knicks, but the bottom line is there's not going to be any arenas that we're going to get to sit in. So there's certain things we can't do. But Westchester County is trying our best not to shut everything down, but to keep certain things open and operative. I'll continue to mention the three things that I have in the prior updates. Our public golf courses continue to operate. They will operate through January 3rd. Getting a snowstorm this week. I don't expect to see any golfers out on the course this week with a snowstorm. But the bottom line is the courses stay open until January 3rd. If they're playable, they'll be used, and we have over 75 rounds of golf so far on our 6 public golf courses. If it isn't a record, it's certainly a lot better this year than we've done in recent past years. We continue to have a train show on display at Lasden. You do want to call ahead to make reservations. Lasden Park and the Arboretum are located on Route 35 in the town of Somers, northern part of Westchester County. Easily accessible from the Taconic or the I-684 if you're coming south to go north. If you're already in the northern communities, Route 35 is sort of the main street of northern Westchester. It goes right to the front door of Lasden. It's a beautiful setting. And again, there is an arboretum there. There's a Veterans Museum. We honor our veterans. We do not forget the sacrifice our veterans have made, and we honor them right there at the Lasden facility. And Winter Wonderland continues also, I think, until January 3rd. It is now a drive-through activity this year at Kensico Dam Plaza, easily accessible off the Bronx River and the Taconic Parkways. Route 22 is nearby, just north of 287, easy to get to. You can drive through it. You can have as many kids in the car as you want. You pay one price for all the kids in the car, and those are 3 recreational entities that continue on. All of our trailways are open. North County Trailway, where we've invested money to make it look much better today than it's looked in the past. South County Trailway, that's going to get attention with capital projects ahead of us. The Bronx River Parkway Pathway. We have a short little 1-mile pathway alongside Playland Parkway, and they're working to improve that. That's a nice walking pathway that takes you into the Playland Amusement Park. And although the amusement park is closed, the boardwalk is open. The beach at Playland is open for dogs. You can bring your dog down to Playland. We are closing most of Playland parking lot because we've got construction work and repair work to do down there, but there is sufficient amount of the parking lot that remains open to accommodate visitors who come park and then go out to the boardwalk or to the beach. And the Reed Sanctuary is one of our 6 nature preserves in Westchester County. They're beautiful places to go out, get fresh air. You can do that safely. You can mask up while you're with other people. And then when you're with your immediate family that you live with, you can be a little more in a relaxed environment and take a walk through the woods. And that's at Lenoir in Yonkers. That's at the Marshlands in Rye, at the Reed Sanctuary north of Playland, Trailside up in Cross River, Cranberry Lake in North White Plains. Lots of beautiful places that you can walk through. Other parks that aren't officially nature centers that are open. And then also, when you're home every day and, that the person you live with says, you got to clean out the basement, you're going to find articles that you want to dispose of properly that you can't just put out in the garbage. Got an answer for that for you. We have a household cleanup center that exists on our Valhalla campus, and you can load up your car with certain kind of products that can't be put out in your garbage, and you can take them to that location. You want to call in advance to get an appointment. It's on the Valhalla campus. It's near where the county jail and the medical center is. But Tuesday through Saturday, it's open. You call in advance, load up the back of the car, make that person you live with happy, your spouse. You cleaned out the basement. You did something while you were home with COVID, and obviously you don't want to go out of the house unless you're free of COVID. But you can take that, and Westchester County has that service open for you, as we have the cleanup days that we've had early in this year. All of those things tell you that we are trying our best to have as normal a life experience as we can, given the fact that we're still going through this pandemic and we will still go through it for a few more days. I've just about reached the 1-hour mark. Let me close by complimenting the Westchester County Board of Legislators. Just a few minutes ago, an hour or two ago, they passed the proposed 2021 budget. It has now been passed by the legislature. It was a bipartisan, unanimous vote. That budget cuts property taxes by $1 million in the tax levy. Second straight year that we've cut property taxes. There'll be a more extensive explanation. The board themselves either has or will have a press conference today. They probably have already. And then on Wednesday, we'll go through the budget bill in a final form, sign it publicly on Wednesday. I believe that's scheduled in the morning, but whenever it is, you'll be able to watch it. and we'll put that into effect, and we think it's a good budget for next year. I want to compliment the chair of the Board of Legislators, the Honorable Ben Boykin, who is responsible for everything that comes out of the legislature. It's a job I had 20 years ago. I know how tough it can be, and Chairman Boykin has done a very good job of dealing with it. We have the majority leader, Mary Jane Shimsky, and the minority leader, Margaret Kunzio, two different political parties, both of which work together, compromise, disagreement, agreement, and then settling on a final document. We want to recognize the vice chair of the board, Alfreda Williams, and then also the majority whip, Chris Johnson, for their role in all of this, and most importantly, the chair of the Budget and Appropriations Committee, Catherine Borgia, who spearheaded the dialogue about this. We have, what I'm very proud of, is a good working relationship between the Board of Legislators, the executive branch. We don't always agree, and that's perfectly fine. I think they call that democracy. But we've closed the budget. It's got changes in it that were made by the Board of Legislators, changes for the better. We expect to sign it on Wednesday, and we'll include some things. We'll talk more about it from them. But as this closes off, what is this update about? This update is about where are we with COVID. COVID continues. We're not over yet, and an exhortation to do the common sense things, not because we mandate it, because we can't mandate it at the county level, but because it's the right thing to do. That we are in this cooperatively between the local governments and the county government, working under the aegis of the state government to try to implement this. That we are looking toward the vaccines. We're looking toward trying to help our businesses. We are looking toward trying to structure a government that cuts property taxes but delivers basic services. All of those things together is what we think, royal we, is what people expect us to do. And on a very personal level, as the county executive, this is what my commitment is. This is what I promise to do. And this is what we're trying to do every day. It's 3 years deep. Nobody promised us a pandemic. We have it. Now we deal with it as mature adults. We deal with it calmly, no rabble-rousing, no sugarcoating of the problems, no fear-mongering of the problems, just common, basic, intelligent moving forward. You might disagree with anything we've done. That's called democracy, and I accept that. But you can't say that we're not trying to communicate to you with the facts of the day. We'll be back again on Thursday to give a further update on COVID. We'll be back on Wednesday to close out the budget, which is a major action for the year, and we have a few other things. Now, we do have some questions that have come from the press, so I've closed out my comments. We're slightly into the second hour. If there's a soap opera right now that's on TV that's more compelling than this, by all means, patronize the soap opera. But if you don't want to see the soap opera, let's go to questions and let's see what we have from our working press.
First two questions are from David Proper with the Journal News. He asks first if you have any concrete dates and locations as to where the vaccine is going and when.
No.
Okay.
David, simple as that. We don't have concrete information yet. As soon as we do, we'll be happy to release it. We think the state will probably release it on their own. But as soon as we have it, we'll share that with you.
His second question is, do you wish there was more information from the state at this point, and do you expect more information as the week continues?
I do expect more information as the week goes along. I think that they are one of 50 players in a federal, challenge, and how the federal government works this out. And of course, let's realize where we are in the federal government. We're within 40 days of an administration change. And, not to get into the politics of it, but the bottom line is the people who are in office today, are not likely to be the people in office 40 days from today. So the federal government's response on this is going to be problematic, and they have to work with 50 states, New York being one of them. I expect New York the state will reveal more information as they have it, and obviously when we have it, we'll share it with you. And I think we've had a good working relationship with the state. We've been in contact with them on a regular basis. Now that we're in the 3 o'clock hour, Joan McDonnell is on the regional control room call as we speak with the other 7 counties in our region talking to the state. So I'm hopeful that we'll have more information as the week goes along.
Okay. And the next question and the last question is off topic from Jonathan Gordon from News 12. He asks, do you plan to sign the budget?
Yes, I do. Jonathan, I do want to take a closer look at it before I do. The budget is a complicated document. Some changes have been made by the Board of Legislators. We think we understand the changes. We think there are good, valid changes, but I want to make sure that my staff and I have had a chance to look at it in some detail. So I expect we will sign it on Wednesday, but I reserve the right just to go over it in some detail. We have the authority, as most executives do, of line item veto and then overall veto of the budget. I don't expect that's going to happen this year. I think this was a well-negotiated budget. I think the Board of Legislators added value to it. But most importantly, I think that the commissioners and the department heads of this county government did a near brilliant job in the middle of a pandemic figuring out how we get through this. And the other senior members of my team, the policy decisions that we've worked through, the voluntary separation agreement, the decisions made to reduce spending in different ways to help get us to a finish line that we have, all I think have contributed to a good, solid budget. Whether that budget will hold all throughout 2021 will depend on how the state deals with its budget gap, what the federal government does in supporting local governments such as county governments, and it'll depend on how fast our economy can rebound from this. And that, of course, is completely unpredictable. That will depend on how fast we put the virus behind us.
That's the last question.
Very good. Thank you for watching. Have a wonderful day. Stay safe. We'll interact with you over the next few days to give you some updates. And again, we want to wish to all of our Jewish brothers and sisters a very happy Hanukkah, Festival of Lights. And for all of our Christian brothers and sisters that are anticipating the joys of Christmas, they're within a fortnight of us right now. And hopefully this will allow you that opportunity and peace within yourself to go beyond what we do here in secular government into something larger and more spiritual as you see fit. I'm George Latimer, Westchester County Executive. Thank you for watching. We'll see you soon. Be safe.